You are listening to part 66 of our series, 7 Medicines, The Wise Woman Way with Susan Weed at Time Monk Radio. Hello, Susan, and welcome back to Time Monk Radio.
Hi, Gemini. Did you become hyper aware of the histamine in your body last week?
I did, and I also told my daughter she can no longer burn candles and incense in her room. It's like an ashram.
Right.
I told her what you said, and she was like, oh.
Oh, my gosh.
Yes.
Who would have guessed? You know, we think, oh,
I
so
know.
benign. Actually, what I've done is I've switched away from petroleum-based candles.
Yeah, like soy or something?
Soy candles are available, and there's palm oil candles, and, of course, beeswax.
Yes, beeswax.
And there's far less pollutants released when those candles are burned.
Yeah, I had no idea. We're going to pay closer attention to that, too.
Yeah. And maybe she can burn the incense when she's at school, if that's
Yes.
okay with you. You know, so
Yes.
long as you have something to catch the ash and you're not worried about burning the house down.
Right.
And right. My friend that I visit in Tucson does that. She has some wonderful incense that she gets from Nepal. And she burns it in the guest room the day before the person comes in.
Oh,
so that
nice.
when you come into the room, it's just like this light background scent of the incense.
Oh, that does sound lovely. I'll have to remember that.
Really, really nice way to do it. Well, last week we got into histamine. I hope you found it as fascinating as I do.
I find it extremely fascinating, yes.
Yeah, because I'd always known that histamine was doing things for me, but I really, a huge amounts of things that this simple, small, flexible little compound does. Thank you, histamine. Histamine has stimulating effects upon neurons, but it also has suppressive effects. And this is a theme that we have played with many, many times. For reasons that are only clear if you take organic chemistry classes, drugs do not work the same as a natural substance. So if we had a natural antihistamine, it can have both stimulatory and suppressive effects, but if we have a drug, it is only going to have suppressive effects. That's why it's an antihistamine. Now, suppressive effects, that's good. That protects us against convulsions, against supersensitivity, against becoming too sensitive to drugs, and so on. And the most interesting thing of all about histamine in the brain is histamine seems to be in control of our ability to forget bad things. It makes me think that maybe people who hold grudges are taking antihistamine.
It's curious.
The injection of histamine into the corpus cavernosum in men who are impotent produces at least a partial erection in 74% and often a full erection. And we're going to go back to that thing that we were talking about at the very beginning, which is blood vessels dilating. And so when the histamine is in the sexual organs, it causes dilation of those blood vessels, and dilation of those specific blood vessels around the sexual organs is what we call getting turned on. Libido loss and erectile failure occur during treatment with histamine H2 receptor antagonists. And it is also suggested that these antihistamines might also reduce the uptake of testosterone. When we start talking more about antihistamines, we will talk a little bit more about the receptor sites. There are, in fact, at least 4 different histamine types of histamine receptor sites: H1, H2, H3, and H4. The drugs that we have at this point primarily target H1 and H2. metabolites of histamine are found to be increased in the cerebrospinal fluid of people with schizophrenia. But the efficacy of the H1 receptor site has been decreased. In fact, atypical antipsychotic medications often have the effect of being an antagonist to histamine production. Histamine therapy for the treatment of multiple sclerosis is currently being studied. Histamine has been shown to help with T-cell differentiation. In multiple sclerosis, the body's immune system attacks the myelin sheath on the nerve cell. I was told to think of the nerve cell as an electrical wire, and that the myelin sheath is like that rubbery coating around the wire. So long as that rubbery coating is intact around the nerve signal goes from one place to another, just like in the wire. But if that wire is broken and the coating is broken, then the charge can escape from the wire. And similarly, in multiple sclerosis, because the myelin sheath is eaten away by the immune system, the nervous signals don't get to where they're supposed to go. By helping T cells to differentiate, those T cells are much less likely to attack the body's own cells. Different H receptors have different effects. H1 and H4 receptors increase permeability in the blood-brain barrier, and thus they increase inflammation and worsen symptoms, while H2 and H3 receptors can actually decrease symptoms. So, again, when we are working with natural antihistamines, they are much more likely to have the ability to bind to all four histamine receptor sites, whereas when we are taking a drug, we find that they are targeted and very specific to a site. Okay, let's look at those drugs. Antihistamine drugs inhibit the action of histamine in the body by blocking the receptor sites that the histamine docks into. In other words, an antihistamine doesn't really get rid of the histamine at all, or directly interfere with production of histamine. What antihistamines do is they don't let the body absorb or utilize the histamine. All antihistamines are considered drugs that are used against the immune system. And I also had to read that several times and whoa, antihistamines are considered to be difficult on the immune system, kind of on the order of chemotherapy. And we make a big deal about chemotherapy, but we make no big deal at all about taking antihistamines. Again, they're sold over the counter. They're used to treat the symptoms of colds. They're used to treat the symptoms of allergies, skin things, hives, and so on. A huge number of things, and yet they have a detrimental effect directly on the immune system. Again, remembering from last week, histamine is released when an allergen enters the body. Histamine is already made in the mast cells, and there's an IgE antibody hanging there. When the allergen comes in, triggers that boing! It has sprung the trap, and histamine is released, leading to swelling of soft tissues, especially in the nose, throat, and lungs. H1 histamine receptors initiate itching, rashes, hives, burning, and severe inflammation of the affected tissues. Just got a holiday card from people who were live-out apprentices, a lovely man and a woman that he wound up marrying, and her mom. All three of them came as live-out apprentices. It was wonderful knowing them and wonderful continuing to know them. And the mom unfortunately has had some health challenges in the past year, including dealing with burning mouth syndrome. And we very much think that this is a histamine reaction where the mouth literally feels like it is on fire. Oral and injectable antihistamines such as Tagamet, Zantac, Axid, and Pepcid block the H2 receptors, and those, of course, are the ones that are the runny nose, runny eyes, runny ones. Antihistamines are used to treat huge numbers of problems, but primarily hay fever, allergies, conjunctivitis, stuffy nose, runny nose, chickenpox, chronic fatigue, dermatitis, hives, eczema, molluscum contagiosum, interstitial cystitis, severe sleep deprivation, motion sickness, some gut problems, insect stings, venomous bites, and radiation sickness. Just some of the ways that antihistamines are used. There are so many antihistamines that I was wondering how anyone could make a choice between them. The lists go on and on and on. Over-the-counter antihistamines, chlortrimeton, Benadryl, Drixenol, Triaminic, Diametane, Tavist. They come in a variety of forms, including antihistamine eye drops, like Alloway, Zyrtec, Claritin, Opcon, Visine. They come in nasal sprays, like Astelin, Dimista, Pantanase. And, of course, there's those second-generation antihistamines, the Claritin, the Alavert, the Zyrtec, the Clarinex, the Allegra, the Zizal. So, since I don't take antihistamines, I didn't have any personal opinion on what would possibly be the best kind of thing to use. So I went to Consumer Reports. And Consumer Reports said, the antihistamine drugs that we evaluated all seem to work equally well at relieving symptoms, with none being clearly better or safer. The real difference was how much they cost. Some cost under $11, and some cost more than $200. I'm assuming that's for a supply, that we wouldn't be buying a single antihistamine pill for $11 or $200. So their best buys are all low-cost generic antihistamines, which can be found in liquids, tablets, chewable, or dissolvable, and can be bought without a prescription. And they do note that while all of the antihistamines work equally well, they don't work equally well in every person. And this is one of the reasons for having a variety of antihistamines. So, of their 3 Best Buy choices, if you choose one and it doesn't seem to work for you, it's okay to choose another one and to see if that one will work better for you. And they have given us not the brand names, but the generic names of these. And that is cetirizine, C-E-T-I-R-I-Z-I-N-E, cetirizine, fexofenadine, F-E-X-O-F-E-N-A-D-I-N-E, and loratadine. Loratadine is a second-generation antihistamine, and it's most commonly sold under the brand name Claritin. Fexofenadine is also a second-generation antihistamine, usually sold under the brand name Allegra. And I was not able to find the brand name. Oh, here we go. The brand name for cetirizine is Zyrtec, and it is also a second-generation antihistamine. So, Consumer Reports also says, before you start to take an antihistamine, be sure you have an allergy. Not a cold, for example. Some people take antihistamines because they think they have an allergy when something else is going on. They might have a nasal polyp, or they might have heartburn, which is making them think they have an allergy. Or remember, last week we talked about many people have a non-allergic rhinitis that looks like hay fever but is not at all. There are side effects to antihistamines, and so we don't necessarily want to run right out and take them if we can do something else, and if they're not the best choice for what's really going on with us. The side effects of antihistamines, we've already talked about some of them. Drowsiness, right? But also blurry vision, lightheadedness, change in the ability to think clearly, dry mouth, dry nose, dry throat, thick mucus throughout the respiratory system, gastrointestinal upset, stomach pain, nausea, and premature presbyopia. Are you old enough to know what presbyopia is, Gemini?
I don't think so, no.
Presbyopia is the thing that happens as you get old, where your arms get shorter and shorter and you cannot hold the book far enough away.
Oh, yes, I suffer from that.
Myopia, you have to bring things very close to see them. Presbyopia, they have to get further and further away from you. And eyes do tend to become more presbyopic as we age, but taking antihistamines causes it to happen prematurely. There are also increased effects of taking antihistamines in people who have kidney disease, because these people who have impairment in their kidney function, the kidneys cannot get the antihistamine substances out of the body as quickly as strong and healthy kidneys do. And those substances then wind up in the kidneys, and they can actually have some difficulty with the kidneys themselves. Whoa! Antihistamines. First generation antihistamines. Second generation antihistamines. Here was an interesting quote from a website where people were coming and talking about their use of antihistamines. And this is one that I picked out, but it was repeated in various voices and various guises. And this person says, I started with Claritin, and it worked real good for me for 2 years. And didn't seem to not work at all. So I went to Flonase, and that worked great for 2 years, but then all my symptoms came back with a vengeance. And so now I started using Allegra, and Allegra, that worked just fine for 2 years, and I'm switching off again now. And as I said, this was a commonly repeated theme. Not only do different people respond to different antihistamines, but our bodies do tend to become numb to the effects of them. And if you take antihistamines on a regular basis, and there are people who do so, it seems pretty likely that one of the side effects is going to be they're going to stop working, and you're going to have to switch off to some different kind of antihistamine to get the effect that you are used to having. Decongestants work a little differently than antihistamines. Remember that what the histamine does is it opens up the blood vessels. So antihistamines close down the blood vessels and at the same time release nitric oxide, which causes a drop in the blood pressure. Decongestants specifically go in and constrict and narrow the blood vessels. And that means that they really cut down on the amount of secretions coming from the eyes, the nose, and so on. You can get decongestants as nasal sprays, pills, and liquids, and of course they are widely promoted for people who are dealing with colds. Decongestants, unlike antihistamines, don't relieve any of the other reactions that we have to histamines like itching, sneezing, skin problems. So decongestants are pretty much used just for the runny part of the histamine reaction and side effects from decongestants. Well, interestingly enough, it's pretty hard to find just a decongestant out there. In fact, most of the time, the decongestants are bundled with a histamine, and then you get the same kind of histamine problems, but then you add to them side effects from the decongestant. So you get drowsiness, and even in those second-generation antihistamines, don't count on them not making you drowsy. Again, individual people react quite differently, and some people do get quite drowsy even from the second-generation ones. Coughing, increase in blood pressure, headache, nausea, nervousness, difficulty sleeping, and rapid heart rate are some of the side effects that we are likely to get from decongestants such as Claritin, Sudafed, Allerest, Neosynephrine, Afrin, Astelin, and I'm not mentioning all the big brand name drugs. All you have to do is walk into a drugstore and look at the shelves upon shelves of antihistamines and decongestants there. The prescription antihistamines can have more severe side effects, which of course is why they're by prescription, but they also tend to have more severe effects. In other words, stronger and better effects. And they would be things like Zysal, Perlactin, Clarinex, Visitril, Panatol, Elestat, and then combination things, and if it's got a D after it, that means it's been combined with a decongestant. So Allegra D is fexofenadine and pseudoepinephrine. And Semprex D is acrovastine and pseudoepinephrine. And Trinolin is azitidine and pseudoepinephrine. When someone fears that they could go into anaphylactic shock from a bee sting or from any other allergen, they will usually carry with them an EpiPen, which contains epinephrine, pseudoepinephrine. It's called an EpiPen because the epinephrine decongestant is very important at stopping the anaphylactic response to the histamine. There are other types of drugs used to treat allergies, asthma, and the things we've been talking about that are not antihistamines or decongestants. And one of those, of course, are steroids, corticosteroids, as nasal sprays, topical creams, ointments, tablets, injectables, even eye preparations. Corticosteroids reduce inflammation, but they weaken the immune system and make it much easier to get a new infection or to have the infection that you may already have get a lot worse. As I said, next month we are going to get very deeply into the steroids. So I will just mention that they are a type of drug that is frequently prescribed for people dealing with allergies. Mast cell stabilizers such as chromium sodium, and those are used as eye drops, nasal sprays, and orally. And they are pretty interesting because they actually help prevent allergic reactions from happening if taken regularly. The chromium sodium is a mast cell stabilizer. Basically what happens is it prevents that trigger from being sprung. And it's most effective if you use chromium sodium before you've come into contact with the allergen. And you can use it alone, or it can be prescribed with other medicines. The leukotriene inhibitors that we talked about, that huge selling drug, leukotrienes are released during an allergic reaction, not just histamines, but leukotrienes, and they aggravate allergic conditions, especially asthma. Singulair decreases how many leukotrienes the body creates in response to an allergen. However, taking Singulair causes suicidal thoughts, and it's a tricky drug to get off of. Possible side effects include flu-like symptoms, nervousness, headache, stomachache, nausea, and vomiting. And there are also nasal anticholinergics. Whoa! They relieve discharge, but don't relieve a stuffy nose. Auto-injectable epinephrine. I was talking about an EpiPen, a very important antidepressant, the tricyclic antidepressant Zonolon, used in cream form, turns out to be pretty effective at stopping itches and severe skin irritation from histamine reactions. And there are the immunomodulators, again, usually used just on the skin surface, topical medicines to treat allergies that have a skin symptom. They are generally used only if all other treatments have been found ineffective or even intolerable. I certainly hope that none of us ever have to need antihistamines. But we will. We will be stung by a bee. We might not be bitten by a poisonous snake, but we're going to be exposed to pollens. I've been hearing a little pitter-patter of, I guess, mousy feet up in my unused attic area, unfinished. There's not even a floor up there. And soon after hearing that, when I walked into the room where I was hearing it, I started to sneeze, and I thought, oh my goodness, my body is releasing histamine in reaction to substances that the mouses are releasing. We won't mention those. And I'm going sneeze, sneeze, sneeze. Again, histamine protects us. It's getting those allergens out of my nose. And fortunately for me, it's a mild reaction. I sneeze 4 or 5 times, I blow my nose, and it's all over. But for many people, histamine reactions are a big deal, and we're going to be spending the next couple of weeks looking at ways that we can help ourselves with antihistamine herbs and other natural substances that work better than drug antihistamines in our bodies. I'm looking forward to spending that time exploring with you, Gemini.
I look forward to exploring with you as well, Susan. Thank you so much for joining us. And that concludes part 66 of our series, The 7 Medicines the Wise Woman Way with Susan Weed at Time Monk Radio.